Do you have rheumatoid arthritis and you're feeling exhausted all the time even though your labs look fine? You're not imagining it. Fatigue in RA is real and manageable. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about one of the most frustrating and misunderstood symptoms of rheumatoid arthritis: fatigue. If you've ever felt like you've been hit by a truck, even after a full night's sleep, you're not alone. RA fatigue isn't just being tired. It's a deep, overwhelming exhaustion that does not go away with rest. This kind of fatigue can impact your job, your relationships, your ability to enjoy life, and that's why it deserves more attention. Let's break it down. Why does fatigue happen in RA? What can you do about it? And how can we approach it in a way that actually works? So what causes fatigue in rheumatoid arthritis? There are several reasons why people with RA feel fatigued. Here's a breakdown. First off is inflammation. Chronic inflammation from your immune system being overactive is a major driver. Your body is constantly fighting itself, and that drains energy. Pain and poor sleep. Ongoing pain makes it harder to sleep deeply. And when sleep is disrupted, fatigue gets worse. Medications. Some RA meds help with inflammation, but can also cause fatigue as a common side effect. Then there's deconditioning. If you've cut back on activity due to pain, your muscles get progressively weaker and your endurance can drop, which adds to the fatigue. Mood and mental load. Depression and anxiety are more common with RA and also contribute heavily to fatigue. And then there are nutritional deficiencies or metabolic issues, such as low iron, low B12, thyroid issues, or insulin resistance can also play a role. They're not specific for RA, but they are things that we commonly see in the general population, including in our rheumatoid arthritis patients. So what does RA fatigue feel like? It feels like waking up more tired than when you went to bed, struggling to concentrate or get through simple tasks, needing a nap by midday but still feeling drained, feeling like you're running on empty even on your good days. This isn't laziness, this is the disease, and we need to treat it that way as well. Let's talk about some very important principles when it comes to fatigue in RA. Principle number one is that you want to get inflammation under control. This is foundational. If you're in an RA flare or have chronic low-grade inflammation, your fatigue will not easily improve. You want to work with your rheumatologist to find the right level of treatment to control your RA. So if you have active inflammation on labs, imaging, or exam, you may need to escalate medication or consider additional options like biologic medications. For patients with mild disease, on the other hand, you'll want to focus on optimizing lifestyle, anti-inflammatory diet, gentle movement, and appropriate supplementation. Principle number two is you want to optimize your sleep. If you're not sleeping well, your body cannot heal and recharge. Stick to a consistent bedtime. Limit screen time and caffeine late in the day. Treat pain before bedtime. This includes hot packs, stretches, or the right medications. And if needed, evaluate for sleep disorders like sleep apnea, especially if you're waking up tired even after 78 hours of sleep. Small adjustments in your bedtime routine can lead to big improvements in how rested you feel. Principle three, movement is medicine. It might feel counterintuitive, but movement actually helps reduce fatigue. You want to start low and go slow. Gentle activities like walking, yoga, swimming, or stretching can be enough to get started. Regular movement helps to reduce pain, improve sleep, and boost your energy. Remember, we're not aiming for perfection, we're aiming for consistency. So I tell patients, even 15 minutes a day is better than zero, and you can build up from there. Principle four, nutrition and supplements. Fueling your body the right way makes a difference. Focus on whole foods, vegetables, lean proteins, and healthy fats. Avoid high sugar and highly processed foods that increase inflammation and cause energy crashes. You want to stay hydrated. Dehydration can increase fatigue. Consider also checking for low vitamin D, iron, or B12. These are treatable contributors to fatigue as well. And then consider supplements like omega-3, curcumin, and magnesium, which may also help, especially if you're deficient. Principle 5, the mind-body connection. Your mental and emotional well-being affects your physical energy. Practice stress management techniques such as meditation, deep breathing, and if needed, therapy. Fatigue can be worse when anxiety and depression are untreated. Acknowledge your limits. It's okay to rest, but plan your energy too. Use the concept of energy budgeting. Decide where to spend your energy each day and build in recovery time. Principle 6, rule out other causes. Make sure you're not missing other medical issues. Ask your doctor to check your thyroid, blood counts, and blood sugar. Address anemia, sleep apnea, or insulin resistance if they're present. The goal is always to find all the contributors, not just assume it's just your RA. Here's a real-world patient example. A 42-year-old woman came in feeling exhausted. Her rheumatoid arthritis was in remission based on her labs, exam, as well as her imaging, but she was still feeling completely wiped out. We ran some labs. Turned out she had low iron, borderline low B12, and very poor sleep due to undiagnosed sleep apnea. With iron supplementation, a B12 shot, and treating her sleep apnea, her fatigue improved tremendously, up to 70%, without requiring changing her RA medications. Small wins add up. RA fatigue is frustrating, but you're not powerless. Even small steps, better sleep, cleaner diet, more movement, and good stress management can make a huge impact over time. Think of it like a puzzle. No single piece fixes the fatigue, but together they create a better quality of life. Fatigue in RA is real, common, and multifactorial. You can reduce it by controlling inflammation, improving sleep, eating well, moving your body, managing stress, and identifying other treatable causes. Small, consistent actions can create long-term energy gains. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're struggling with fatigue from rheumatoid arthritis and want a personalized treatment plan, reach out to our office. We're here to help you live well and feel your best every day. See you next time, and live well.